Hello everyone, in this video we'll be studying about mastoidectomy. I am Dr. Sanya Datta, MSENT. Now let's begin. Coming on to cortical mastoidectomy. It is also known as simple mastoidectomy or Schwartz operation. There is complete exenteration of all accessible mastoid air cells and converting them into a single cavity, keeping the posterior meatal wall intact. Now coming on to radical mastoidectomy. It is a canal wall down mastoidectomy performed to eradicate disease from middle ear cleft in which mastoid cavity, tympanum and EAC are converted into a common cavity exteriorized through the EAC. All remnants of tympanic membrane, ossicles, except stapes footplate and mucoperiosteal lining are removed. Eustachian tube is obliterated by a piece of muscle or cartilage. Now coming on to modified radical mastoidectomy or MRM. It is a modification of radical mastoidectomy where as much of the hearing mechanism as possible is preserved. It is a surgical procedure where the disease process is eradicated from middle ear cleft, followed by converting the mastoid cavity, middle ear and EAC into a single smooth self-cleansing cavity exteriorized through EAC. Now, what are the indications of cortical mastoidectomy? First, coalescent mastoiditis and masked mastoiditis. Second, COM tubotympanic disease, active, refractory to antibiotics. Third, secretory otitis media, refractory to antibiotics. Fourth, as an approach to endolymphatic sac surgery, facial nerve decompression, vestibulocochlear nerve section, translabyrinthine approach for CP angle, cochlear implant surgery, and for combined approach, tympanoplasty. Now, what are the indications for MRM? There are absolute indications and some relative indications for MRM. First, let's study about the absolute indications. First is unresectable disease. Second is unreconstructible posterior canal wall. Third is failure of the first stage canal wall up procedure due to poor eustachian tube function. Fourth, inadequate patient follow-up. Now, what are the relative indications of MRM? First, disease in the only hearing ear or in dead ear. Second, medical illness. Third, severe otologic or CNS complications. Fourth, neoplasms. Fifth, poor eustachian tube function. Now, what are the indications of radical mastoidectomy? First, unresectable cholesteatoma extending down into the eustachian tube or into the petrous apex. Second, promontory cochlear fistula caused by cholesteatoma. Third, chronic perilabyrinthine osteitis or cholesteatoma that cannot be removed and must be cleaned or inspected periodically. Fourth, resection of temporal bone neoplasms with periodic monitoring. That is all in this video. I'll be meeting you in my next video. Thank you so much for watching.